Is sunshine safe for your infant? Studies show sunning your baby for 15 to 30 minutes a day have great health benefits, from healthy bones and teeth to happy hormones and sleep to skin and heart. Always follow your intuition and do what's best for your baby.
A lot of the things on this list actually make sense, and they especially make sense for adults and older kids, but they don't really apply to infants. And so the conclusion that you should intentionally expose your newborn to sunlight is wrong. No, you should not do it. But let's talk about them. So does sunlight promote a normal and robust cardiac rhythm? Pretty much all infants are in normal sinus rhythm. SVT and other arrhythmias are quite rare, and they wouldn't be treated or prevented by sunlight. Does it reduce the risk of seasonal affective disorder? So you can't make this diagnosis in infants, so this definitely doesn't make sense and is applying adult logic to babies. Could you have changes in behavior? Sure, but it's not well studied or characterized. Can it help prevent diabetes to a certain extent? So there is some adult associative data about insulin resistance, but remember that the type of diabetes that affects adults is very different from the type 1 diabetes that affects kids. And then know that infants getting diabetes is unbelievably rare. So this, of course, does not apply. The two that actually make the most sense on this list to me are: one, does it help the body produce vitamin D? And the answer is yes, and it's a big deal for infants because they're at high risk of vitamin D deficiency. What's the problem here? Well, basically, you will not be able to expose your infant to enough sunlight to guarantee they have healthy levels of vitamin D. So if they take less than 28 ounces of formula per day, you need to be supplementing with vitamin D drops anyway. And then second, yes, sunlight can reduce levels of bilirubin and treat jaundice to a certain extent. The problem here is that if you have mild jaundice, you don't need to treat it anyway. And if you have serious jaundice, then you really need to be treated in a controlled setting with phototherapy where you can monitor the levels as it comes down.